Aphasia. Aphasia is the acquired disorder of previously intact language ability. As such, it is not interchangeable with failure of language development. Aphasic patients have disturbances of speech, writing, and reading. The most widely used classification of aphasias was developed by Benson and Geschwin. In this classification, 3 aspects of language are used to classify 8 aphasias. Fluency. Fluency refers to several features of spontaneous speech: rhythm, melody, articulation, and word production rate. When testing spontaneous speech, look for verbal, that is substitution of one word for another, such as knife for spoon, and phonemic, that is substitution of incorrect sounds, such as spork for fork. Paraphasic errors. Paraphasic errors in the fluent aphasias primarily, and naming abnormalities are the hallmarks of aphasia. Comprehension abilities vary from following midline commands, such as stick out your tongue, to performing multi-step requests, such as take the paper in your left hand, fold it in half, and put it on the floor, to understanding relationships, as in, the lion was killed by the tiger. Which animal died? And number 3, repetition of phrases may be impaired to various degrees. The most difficult phrases to repeat are those involving grammatic function or low-frequency words. For instance, you know how, or the spy fled to Greece. Additional testing of reading out loud and reading comprehension and writing to dictation or spontaneously is often used in evaluating patients suspected of having aphasia. Damage to the thalamus, caudate, putamen, and surrounding structures may produce aphasia. Initial muteness improving to a fluent or non-fluent hypophonic aphasia is common. Paraphasic errors in spontaneous speech, which disappear when the patient is asked to repeat phrases, and rapid resolution of deficit are hallmarks of these subcortical aphasias. Other syndromes related to aphasia but involving only a single language modality include aphemia, or pure word dumbness, inferior frontal dominant hemisphere lesions, pure word deafness, lesions of the dominant superior temporal lobe, or bilateral middle portion of the superior temporal gyrus, and alexia without agraphia, left occipital lesions, including posterior corpus callosum. The classification is based on patients with stable deficits. The acutely ill patient may not be easily classified. Spontaneous recovery often occurs in the first month after onset and may continue for several more months. Speech therapy, individualized for the form of aphasia, may be helpful in the recovery of language function. And that is aphasia. Have a great day.